Clearly after what's going on in Wisconsin, right? So, okay, back to serious stuff here. Your board of the Alliance has been working hard over the last year on a strategic plan. The actual work, most of the work was really done by the staff and some others that helped us, but the board did engage in a number of, all of you have been through these, serious 4-hour strategic planning sessions. Our idea behind this is that this organization is 5 years old. It has done some really good things. It has laid a really good foundation for its work. And it's time to now think about the next 5 years. And so that was the spirit in which we embarked on this. And while I'm mentioning this, I wanted to say that solid foundation was largely put in place by Margaret Stanley. And Margaret is in all of our thoughts because on Tuesday night her husband Tom died. So I think if those of you that are friends and know Margaret, and I know almost all of us do that, do have know her and know her well and highly regard her, that I'm sure appreciate notes and contact. So out of this process for the strategic plan, we came up with first a vision for this organization. Okay. There we go. So I want to mention that on your seats is a summary of what, it's not these slides, but it is a summary basically of the content I'm going to go through, and that's something you can take away with you. But our vision for this community and the reason the Alliance exists is we really want this community to move into the top in terms of quality, evidence-based care, reduced variation, and from that, a reduction in costs. The Alliance came together because of unsustainable cost trends. But one thing we all agree on and understand is you can't attack this problem by going after costs. The way to make healthcare more affordable is to go after quality and variation and the use of evidence-based care. So to get there, we identified 4 strategies, which I'd like to briefly talk through with you. Performance measurement reporting, consumer engagement, payment reform, and performance improvement. So on the performance measurement and public reporting, we have the community checkup. We've learned a heck of a lot about how to do that. I think we're a leading collaborative in our ability to do those, with a lot of support from the data suppliers. We want the community checkup to be the place that people go to, and we want, more importantly, we want the community checkup to actually change the behavior of consumers, providers, and purchasers. Our second strategy is around consumer engagement, and that means we want consumers actually using the community checkup. We want consumers to be effective purchasers and partners in their health care. And we want the organizations that are in the Alliance to be leaders in developing and enrolling people in health plans, benefit plans that incent high-quality health care and discourage low-value care, and thus the purpose of today's session. So you can see how what we're doing today fits into the Alliance Strategic Plan. We also have a strategy around payment reform. First, the Alliance has been an active player and supporter in the multi-payer medical home project, which is going to be a pilot that will be starting soon. We want to actually have that work, and then our second initiative would be to find another similar kind of effort in this community and help in the implementation of that. We want, as a result of this, to actually impact medical trend, and that's why we're doing this work. And then we have a sort of overarching strategy which we're calling performance improvement, which basically says we want to take everything that we're working on and bring it together. And this slide actually shows this graphically. We really want to, through the primary care system, reduce avoidable hospital utilization and ED use, and by focusing on high impact chronic care conditions. To do this, and this was the board spent a lot of time on this. We really want to take all of the pieces of what the Alliance does and bring them together and focus on this area. And that means we would use our measurement and public reporting, our consumer engagement, and our payment reform efforts synergistically to achieve this goal. And finally, I'll wrap up by saying something about this alliance. It only works if everybody plays in it, and it's really great to see this turn out today. We really need everybody in the community to be active participants. We need a strong board that sets a vision, gets the resources, and most importantly, champions the major initiatives of the Alliance. We need a very strong Alliance staff, which we do have, because they're the ones that operate the Alliance and do their research and propose these strategies. And then finally, the members of the Alliance, for this to work, it just can't be a process of us issuing reports and studies and lots of meetings. It actually has to be deployed, and the deployment of our work has to happen in the organizations that are members of the Alliance. The provider community, the health plans, and the employers. And we need all of them to actively deploy these strategies to actually make a difference in the community. So with that introduction of our strategic plan, I'm now going to turn it over to, as I mentioned, our able leader of our staff, Mary McWilliams, the Executive Director of the Alliance, and she will take us from there. So thank you, Mary.